give you a press release. That's exactly why you were here.
Marco, sorry.
I was there. They didn't even guess.
I'm Celeste. And they're working, they're trying to figure out, but apparently it's all fine, so we have to go find Big Dog.
Good job. It's a quick recovery.
Well, they can.
I feel your pain. President, do it like the rest of us. Go with the flow. There you go. That's exactly right. That's all you can do.
Well, there's food drinks over here.
Mark,
Well, this is it.
Pass one if you would.
this is it? Okay.
There's one water.
Okay, whatever, just grab anything, it's cold.
Dick, I don't know if you want, do you want to quarterback this thing or? Sure. However you want.
So thank you all very much for coming. Geez, right on time. I was an ex-reporter and I was never on time for anything, so this is impressive. This is a big day for us and for OHSU, we hope. And we have the big dogs in the room for you. So Dwayne is going to start off by just kind of introducing the concept, and but we're going to keep this pretty informal. So feel free to ask questions as you go, or we can wait later, or we can get sound bites later if you want to, pull people aside individually.
Some pictures would be nice.
Some
too.
pictures would be great. Yeah,
You always
absolutely.
want pictures.
I know, everybody loves that part.
Trying to warn you against that. You keep taking pictures. Well, thank you all for being here. As Dick mentioned, this is a big day in the history and the trajectory of Mid-Columbia Medical Center, and we think also in the future of Oregon Health Sciences University. I know that you had a chance to shake hands. Most everybody, let me just very, very quickly introduce our guest, our partners to my left, Dr. Joe Robertson, President of OHSU, and Mark, I keep forgetting your technical, Dr. Mark O'Halloran is
Vice
the
President for Strategic Outreach.
Vice President for Strategic Outreach for OHSU, and you have a press release in front of you. You can dive through that, and we'd certainly be willing to take questions off of that. I think maybe the best way to go here is for me just to start, say a few things. I'll turn the time over to Dr. Robertson and Mark as well, if they have a few things to say. And then we could just respond to questions that you may have based on the press release and then any statements that we make here. To give you just a little bit of a Reader's Digest background, we began a more, we worked with Oregon Health Sciences University, of course, as the premier academic medical institution in the region for many, many, many years. In earnest, we began probably about 5 or 6 years ago in starting to explore ways that we could work more closely together in terms of forging a stronger relationship, but also I term it broadening and deepening the level of services that we provide here in the Columbia River Gorge to the residents of the gorge that we serve at Mid-Columbia Medical Center, and helping and assisting OHSU in a key part of their mission, which is to become involved in community medicine throughout the state of Oregon, and partnering with organizations like Mid-Columbia Medical Center to improve the quality and level of care that's available for all the residents of the state. And we began some time ago in pursuing excellence in specific programs. We started out in cardiology and ophthalmology. We've been working very closely with OHSU, again, as the premier tertiary quaternary provider in this region of the country, in working closely with our emergency department, telemedicine options, a vital resource for us in terms of support for our physicians and practitioners here in that tertiary and quaternary care arena. But we wanted to take it deeper. And we developed, from the ground up, really, co-developed a cardiology program with Drs. Guaria and Way in really breaking new ground with the ability to take active faculty providers that were trained and had a long history of excellence at OHSU, having them work here full-time and on an outpatient basis, and then providing for our patients the ability to see exactly the same practitioners they see in their office here at OHSU in Portland on the OHSU campus when the need for interventional cardiology was necessary. It's worked incredibly well. We've developed a program that we're just incredibly proud of. And then at a very critical time, we also were able to work with OHSU to broaden and deepen our ophthalmology, or excuse me, our orthopedic services as well. And we just built from then. And it's really culminated now in an agreement that we worked on with both governing boards as well as executive administration and staff. We signed a letter of intent about 1.5 years ago, as I recall now, to put together a very close working collaboration. I'll tell you what this is not. It's not a merger. It's not a consolidation. It's not, there's been no transfer of assets here, but we have forged what we think is the best of both worlds, which allows Mid-Columbia Medical Center to be governed by a local board sensitive to the needs of our region and able to act and react and plan and pre-plan for the needs of our region with just a key strategic partner like OHSU. And this is a long-term agreement on the part of both organizations. We hope this lasts for a good long time. We view this as being permanent with both organizations, where we can work with OHSU to continue to broaden and deepen the clinical programs that we're both involved in. Hi, Peter. You can have a seat. And then OHSU is supporting us significantly in some key areas where we need to trade off of their expertise and economies of scale and helping us become more efficient and effective as a healthcare provider. And two key areas that this collaborative agreement addresses immediately is what we call our physician alignment strategies, where we're working closely with OHSU to manage our outpatient clinics in both primary care and specialty clinics, and to work very closely with them to replace, recruit, and develop additional primary care practitioners and specialty practitioners, both physician and what we call mid-level practitioners, physician's assistants, and nurse practitioners, and work together to recruit and develop programs that will begin today as of the first of this month, and will continue on as we work together to do that. And then key to all of this is moving towards a common electronic health record format or platform. I don't want to get too deep in the weeds here, but a very critical issue in healthcare is this concept of an electronic health record. It's very important in terms of the future of healthcare as we see it. The critical medical information being on a platform that takes us out of the realm of just having everything on paper. We have had an electronic health record at the hospital and in our outpatient clinics, but they've been disparate systems, and we've spent a lot of time, effort, and money trying to make sure they talk to one another. And the system that OHSU has and that they've instituted some time ago, a system called EPIC, is an electronic health record that we couldn't even gain access to because we're not large enough for that company to even allow us to purchase the software and to install a system. So becoming a strategic partner and in this close collaboration with OHSU has allowed us to get on a common information technology medical records platform. They're investing significant resources in assisting us in doing that. We're incredibly grateful for that and their vision in making that happen. And just to give you a little glimpse of what that will allow us to do in conjunction with OHSU, if you can sort of think of this in terms of delivering care at the bedside for the patients, both in an inpatient and an outpatient setting, which is what we're both